For 2 years, part of your Part D drug premium was paid by someone else. Not your plan, not your insurance company, a temporary federal program. Almost nobody on those plans was ever told it existed. On July 28, 2026, one line item confirmed it ends after this year. The Centers for Medicare and Medicaid Services runs Medicare. It publishes these figures each summer. Inside its Medicare Part D numbers for 2027 is one number that decides everything. You may have read that Medicare Part D is ending. It is not. Drug coverage does not disappear on January 1, 2027. Something else does. A 2-year program is expiring exactly when it was built to expire. But the premium is not the frightening part of this story. The frightening part almost never reaches the headlines. It is not a dollar amount at all. It is a count. Somewhere in early August, a man read that headline on a Saturday. He spent the entire weekend believing his drug coverage ends in January. It does not. Nobody mailed him a second letter saying so. January 1, 2027 matters twice, and it moves in two opposite directions. One direction takes the help away, the other takes prices down. And this fall, a phone call is coming with one sentence worth catching. Somewhere else, a woman is on her second drug plan in 3 years. Her first plan simply stopped existing. She was never told why. A third person qualifies for zero premium coverage. Her list got shorter too. All of this traces back to the Inflation Reduction Act, a 2022 law. That is a law, not an individual retirement account. Two different things. It changed who pays and left insurers holding billions they never carried before. That law paid for its changes by shifting cost onto drug manufacturers and, in the largest share, onto insurance companies. By 2024, insurers were positioned to raise Part D premiums sharply for 2025, so the federal government set aside $9.8 billion to ease them in. It was called the Part D Premium Stabilization Demonstration, built for 2 plan years only, 2025 and 2026. Temporary support for a shaky market is not unusual. MedPAC, the Medicare Payment Advisory Commission, which advises Congress on Medicare, says it lowered the average standalone drug plan premium about $26 a month in 2025, about $16 a month in 2026, roughly $312 saved over that first year, then $192. The help was already shrinking before it ended. Now, the number. The Part D base beneficiary premium is a national benchmark built from insurers' own bids. It was $38.99 for 2026. For 2027, Medicare says $41.33. That is a Part D premium increase of $2.34 a month, $28.08 over a full year. But that benchmark is not your bill. Nobody's mailed $41.33. Your own plan's premium can rise more than that, or less, or not at all. So, plainly, Medicare Part D is not going away. A 2-year cushion is expiring on schedule. The benchmark premium rises $2.34 a month, and your choices have shrunk. Here is the count. Not long ago, there were 709 Medicare Part D plans nationwide. In 2025, 464. In 2026, 360. Nobody puts that in a headline. In 2021, the average person could choose among about 30 drug plans. In 2026, fewer than 15. Half the menu gone in 5 years. There is a separate category for low-income enrollees who qualify for zero premium coverage. Those are called benchmark plans. In 2021, the average enrollee had 8. In 2026, 2. 8 down to 2 for the people with the least room to absorb any change. That is the Scarier number. For 2027, large insurers, including Anthem, have cut plans or left whole regions, turning toward Medicare Advantage. About 23 million people hold standalone Part D. Now the other direction. On January 1, 2027, the same day the help is gone, negotiated Medicare prices take effect on 15 expensive drugs. Tradjenta, a diabetes drug, goes from $488 a month to $78. Januvia, from $526 to $80. These are maximums Medicare will pay, not what you pay. Ozempic and Wegovy from $959 a month to $274. Trelegy, a breathing medicine, from $654 to $175. Again, the most Medicare pays, not your counter. Across all 15 drugs, about 44% below 2024 prices. If you take one, whether that reaches your pocket depends on your plan and your coverage year. Someone is building a 2027 household budget this month and cannot get a real number until October. Here is why. The real 2027 plan level numbers are published in September 2026, and plans generally may not market 2027 details until October 1. So anyone telling you in August what your 2027 Part D cost will be is guessing. Say that out loud to anyone who calls. And one piece of this got better and stayed better. The Inflation Reduction Act, the 2022 law, not a retirement account, closed the coverage gap people called the donut hole. It also put a hard yearly cap on what you pay out of pocket for covered drugs. That cap was $2,000 in 2025 and $2,100 in 2026. The 2027 figure arrives with the rest of the numbers this fall. The cap does not expire. 2 words worth knowing because they will show up in your mail. The formulary is the list of drugs your plan covers. The pharmacy network is the set of pharmacies you may use. Both can change year to year. An insurer handed a bigger share of the bill has 5 levers: raise the premium, cover fewer drugs, shrink the network, offer fewer plans, or leave Part D. None of that is announced. It is simply possible. Now the phone call. Somewhere this fall, someone on Original Medicare with a supplement policy will pick up and hear a friendly offer, a $0 drug premium and a gym membership. Medicare Advantage is a different product from standalone Part D. It replaces how Original Medicare is administered, and it uses rebate dollars to hold its drug premium down, which is why the number can look so low on paper. The sentence worth listening for is any version of this: "You can drop the supplement. We will handle everything." Neither product is the villain. Advantage plans fit some lives, supplements fit others, and they work differently. But moving from a supplement to an Advantage plan can be hard or costly to reverse because going back may require medical underwriting, depending on your state and your circumstances. Do not trade coverage you rely on for a small monthly number. So here is what you can actually do. Read the annual notice of change, the letter your plan mails each fall showing exactly what changes for next year. It looks like junk mail. It is not. Then use Medicare Part D Open Enrollment, October 15th through December 7th, 2026. Mark it now, especially if you will be traveling or in the hospital. That window is where you hold the power. Check the drug list. If one of your medicines is on the negotiated list, the whole picture may have changed. Be honest with yourself before switching anything. Will you pay more in 2027? Nobody knows yet. Possibly a little. Some people will come out ahead because a lower price on a drug can more than cover a small premium increase. This is general information, not advice about your situation, and any figure that is not yet official is an estimate. So hold on to the plain version of this. Medicare Part D is not going away. A 2-year cushion is expiring on schedule. The benchmark premium rises $2.34 a month. And the real story is that your choices have shrunk. One more thing, and it is not an ending. A 3rd round of negotiated Medicare drug prices is already set to take effect in 2028. This is not a door closing. It is a process still running.